Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client arrives in the emergency department after severe blood loss from a motor vehicle accident. Which type of shock is the client most likely experiencing? A. Cardiogenic shock. B. Septic shock. C. Hypovolemic shock. D. Neurogenic shock. Correct answer, C. Hypovolemic shock. Rationale: hypovolemic shock occurs when significant blood or fluid loss reduces tissue perfusion. Question 2. Which assessment finding is an early sign of shock? A. Bradycardia. B. Tachycardia. C. Cyanosis. D. Hypertension. Correct answer, B. Tachycardia. Rationale: tachycardia is an early compensatory response to maintain cardiac output. Question 3. Which action should the nurse perform first for a client in shock? A. Obtain a complete health history. B. Administer oxygen. C. Encourage oral fluids. D. Weigh the client. Correct answer, B. Administer oxygen. Rationale: maintaining oxygenation is the highest priority to improve tissue perfusion. Question 4. A client with septic shock remains hypotensive after receiving 4 fluids. Which medication does the nurse expect to administer? A. Furosemide. B. Norepinephrine. C. Metoprolol. D. Digoxin. Correct answer, B. Norepinephrine. Rationale: norepinephrine is the first-line vasopressor for septic shock when fluids alone are ineffective. Question 5. Which assessment finding is most consistent with cardiogenic shock? A. Severe dehydration. B. Decreased cardiac output. C. Massive allergic reaction. D. Spinal cord injury. Correct answer, B. Decreased cardiac output. Rationale: cardiogenic shock results from the heart's inability to pump blood effectively. Question 6. SATA. The nurse is assessing a client with hypovolemic shock. Which findings should the nurse expect? Select all that apply. A. Cool, clammy skin. B. Tachycardia. C. Hypotension. D. Decreased urine output. E. Bounding pulses. Correct answers, A, B, C, D. Rationale: hypovolemic shock commonly causes cool skin, tachycardia, hypotension, and reduced urine output. Question 7. Which client is at the highest risk for septic shock? A. A client with pneumonia. B. A client with a sprained ankle. C. A client with cataracts. D. A client with migraine headaches. Correct answer, A. A client with pneumonia. Rationale: severe infections such as pneumonia can progress to sepsis and septic shock. Question 8. Which urine output indicates adequate organ perfusion during shock treatment? A. 10 milliliters per hour. B. 15 milliliters per hour. C. 30 milliliters per hour. D. 5 milliliters per hour. Correct answer, C. 30 milliliters per hour. Rationale: urine output of at least 30 milliliters per hour suggests adequate kidney perfusion. Question 9. A client develops anaphylactic shock after receiving 4 antibiotics. Which medication should the nurse administer immediately? A. Insulin. B. Epinephrine. C. Morphine. D. Aspirin. Correct answer, B. Epinephrine. Rationale: epinephrine rapidly reverses airway swelling and hypotension during anaphylaxis. Question 10. SATA. The nurse is caring for a client in shock. Which nursing interventions are appropriate? Select all that apply. A. Administer oxygen. B. Monitor urine output. C. Obtain frequent vital signs. D. Establish large bore 4 access. E. Delay treatment until all laboratory results return. Correct answers, A, B, C, D. Rationale: oxygen, close monitoring, urine output assessment, and rapid 4 access are essential interventions. Treatment should not be delayed while waiting for laboratory results. Question 11. A client with septic shock has a temperature of 39.5 degrees Celsius 103.1 degrees Fahrenheit. Which finding should the nurse expect? A. Warm, flushed skin. B. Cool, dry skin. C. Bradycardia. D. Decreased respiratory rate. Correct answer, A. Warm, flushed skin. Rationale: early septic shock often causes warm, flushed skin due to widespread vasodilation. Question 12. Which assessment finding suggests that shock is worsening? A. Increasing urine output. B. Blood pressure of 78/42 millimeter of mercury. C. Warm extremities. D. Improved level of consciousness. Correct answer, B. Blood pressure of 78/42 millimeter of mercury. Rationale: severe hypotension indicates inadequate tissue perfusion and worsening shock. Question 13. A nurse is caring for a client with cardiogenic shock after a myocardial infarction. Which symptom is most expected? A. Chest pain. B. Productive cough. C. Severe diarrhea. D. Abdominal distension. Correct answer, A. Chest pain. Rationale: cardiogenic shock commonly occurs after a large myocardial infarction and may present with chest pain and poor cardiac output. Question 14. Which laboratory value is commonly elevated in clients experiencing shock? A. Lactate. B. Hemoglobin A1c. C. Calcium. D. Platelet count. Correct answer, A. Lactate. Rationale: elevated lactate indicates poor tissue perfusion and anaerobic metabolism. Question 15. SATA. A nurse is caring for a client with septic shock. Which interventions are appropriate? Select all that apply. A. Obtain blood cultures before antibiotics. B. Administer broad-spectrum antibiotics promptly. C. Administer 4 fluids as prescribed. D. Monitor urine output. E. Delay antibiotics until culture results return. Correct answers, A, B, C, D. Rationale: blood cultures should be obtained first if possible, but antibiotics and fluids should be started promptly. Urine output helps assess organ perfusion. Question 16. A client with anaphylactic shock suddenly develops wheezing and facial swelling. What is the nurse's priority action? A. Administer epinephrine. B. Apply a heating pad. C. Encourage oral fluids. D. Obtain a urine specimen. Correct answer, A. Administer epinephrine. Rationale: epinephrine is the first-line treatment because it rapidly improves airway swelling and blood pressure. Question 17. Which finding indicates that treatment for shock is effective? A. Urine output of 40 milliliters per hour. B. Increasing confusion. C. Persistent hypotension. D. Cold, clammy skin. Correct answer, A. Urine output of 40 milliliters per hour. Rationale: adequate urine output suggests improved kidney perfusion and effective treatment. Question 18. A client with neurogenic shock is most likely to exhibit which assessment finding? A. Bradycardia. B. Tachycardia. C. Hypertension. D. Bounding pulses. Correct answer, A. Bradycardia. Rationale: neurogenic shock is unique because loss of sympathetic tone often causes bradycardia and hypotension. Question 19. Which client is at greatest risk for hypovolemic shock? A. A client with severe gastrointestinal bleeding. B. A client with hypertension. C. A client with asthma. D. A client with arthritis. Correct answer, A. A client with severe gastrointestinal bleeding. Rationale: significant blood loss is a common cause of hypovolemic shock. Question 20. SATA. A nurse is assessing a client in the compensatory stage of shock. Which findings are expected? Select all that apply. A. Tachycardia. B. Restlessness. C. Cool, clammy skin. D. Rapid breathing. E. Bradycardia. Correct answers, A, B, C, D. Rationale. During the compensatory stage, the body responds with tachycardia, tachypnea, cool clammy skin, and restlessness to maintain blood flow to vital organs. Bradycardia is not expected. Question 21. A client with cardiogenic shock develops pulmonary edema. Which assessment finding should the nurse expect? A. Crackles in the lungs. B. Dry cough. C. Hyperactive bowel sounds. D. Warm, dry skin. Correct answer, A. Crackles in the lungs. Rationale. Pulmonary edema causes fluid to accumulate in the lungs, producing crackles. Question 22. Which client should the nurse assess first? A. A client with BP 88/54 mmHg and confusion. B. A client with BP 132/80 mmHg and a headache. C. A client with a temperature of 37.2 degrees Celsius 99 degrees Fahrenheit. D. A client requesting pain medication. Correct answer, A. A client with BP 88/54 mmHg and confusion. Rationale. Hypotension and altered mental status suggest poor brain perfusion and require immediate assessment. Question 23. A client in shock has delayed capillary refill. What does this finding indicate? A. Poor peripheral perfusion. B. Improved circulation. C. Increased cardiac output. D. Adequate hydration. Correct answer, A. Poor peripheral perfusion. Rationale. Delayed capillary refill is a sign of decreased blood flow to the extremities. Question 24. Which assessment finding suggests multiple organ dysfunction is developing? A. Decreasing urine output. B. Improved alertness. C. Normal blood pressure. D. Warm skin. Correct answer, A. Decreasing urine output. Rationale. Reduced urine output may indicate worsening kidney perfusion and organ dysfunction. Question 25, SATA. A nurse is caring for a client with cardiogenic shock. Which interventions are appropriate? Select all that apply. A. Administer oxygen. B. Monitor ECG continuously. C. Assess urine output. D. Administer prescribed vasoactive medications. E. Encourage strenuous exercise. Correct answers, A, B, C, D. Rationale. Oxygen, cardiac monitoring, urine output assessment, and vasoactive medications help improve perfusion. Strenuous exercise is inappropriate. Question 26. Which laboratory result best indicates improved tissue perfusion in a client recovering from shock? A. Decreasing lactate level. B. Rising potassium level. C. Increasing creatinine level. D. Elevated white blood cell count. Correct answer, A. Decreasing lactate level. Rationale. A falling lactate level indicates improved oxygen delivery to tissues. Question 27. A client develops septic shock from a urinary tract infection. Which intervention is most important after obtaining cultures? A. Start prescribed 4 antibiotics. B. Restrict fluids. C. Encourage bed exercises. D. Delay treatment until fever resolves. Correct answer, A. Start prescribed 4 antibiotics. Rationale. Early antibiotic therapy is essential to control infection and improve outcomes. Question 28. A client with hypovolemic shock suddenly becomes difficult to arouse. What should the nurse do first? A. Assess airway, breathing, and circulation. B. Offer oral fluids. C. Reassure the client. D. Lower the head of the bed. Correct answer, A. Assess airway, breathing, and circulation. Rationale. The ABCs are always the priority when a client's condition deteriorates. Question 29. Which assessment finding indicates that shock is progressing despite treatment? A. Persistent hypotension. B. Urine output of 40 milliliters per hour. C. Improved skin color. D. Alert and oriented status. Correct answer, A. Persistent hypotension. Rationale. Ongoing hypotension suggests inadequate tissue perfusion and ineffective treatment. Question 30, SATA. A nurse is educating a client about preventing septic shock. Which teaching points should be included? Select all that apply. A. Complete the full course of prescribed antibiotics. B. Practice good hand hygiene. C. Seek medical care for signs of infection. D. Keep vaccinations up to date. E. Stop antibiotics once you feel better. Correct answers, A, B, C, D. Rationale. Preventing infection and treating it promptly reduces the risk of sepsis and septic shock. Antibiotics should always be completed as prescribed.
Score out of 10. Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.